Good morning to Amanda. Yesterday we have discussed related to some important terms related to the cancer. Today we are going to discuss in continuation with the topic to the cancer. So in the cancer means uncontrolled mitosis of certain uncontrolled division of certain cells is called as cancer. Already we have discussed that cancer is of two types. One is called malignant tumor or malignant cancer, and the second one is called benign tumor. So coming on to the benign tumor is also called as non-malignant tumor or starting tumor, or which is confined to a particular place in the body and which does not move from that location, and it is not much harmful like malignant. But when you come on to the malignant tumor or malignant cancer, here uncontrolled state growth of cells at different locations of the body at the same time, or one location, and it is spreading to the different parts of the body. And these cells are also called as neoplastic cells. The cancer cells which belongs to the malignant tumor are also called as cancer cells or neoplastic cells, which grows very rapidly, and it is not specific to only one part, and generally this is concerned to the muscular parts or internal organs of the body, and this is rather much dangerous than the benign tumors. Now we'll try to think of what are the causes of cancer. Causes for cancer. So what are the reasons for causing the cancer? So here carcinogens is, already we have discussed, gen is agent responsible for that. Cancer causing agents are substances or chemicals responsible for causing. So the agents which are responsible for causing the cancers in the human body are called as carcinogens, and because of these carcinogens sometimes the cancers may be caused. So what are these carcinogens and how many types these carcinogens are segregated? Carcinogens are segregated into three types. Physical carcinogens or physical agents, chemical agents, and biological agents. So what are these physical agents of carcinogens? Generally X-rays, Y-rays, gamma rays, X-rays, Y-rays, gamma rays, radiations of different wavelength can cause the physical agents for causing the physical carcinogens or physical carcinogens. Chemicals, tobacco, chemicals, soot, and other chemical components. Coming on to the biological agents, genes or oncogenes, viruses called as viral oncogenes, so and other self-body factors are responsible for the biological agents which can cause the cancers. So when you talk about the carcinogens are the agents which are causing the cancers in the body. So these carcinogens will cause the cancer cell to divide, and these cells are called as neoplastic cells or newly formed cells. They later turn into the carcinogens, as we have discussed, that physical agents, X-rays, Y-rays, gamma rays and radiations of different length of light like UV rays and so on are responsible for the physical carcinogen. Sometimes these can be the reasons for that. And chemical agents like tobacco, chemicals and soot and other chemical substances will cause are also some of the reasons for chemical, like tobacco responsible for lung cancer, and biological agents like biological agents means viral genes also called as oncogenes, and cellular genes, proto-oncogenes are responsible for that which causes the certain type of cancer. So how these cancers can be detected? How the cancer can be detected? How the cancers can be detected? So causes already we have discussed, and detection of cancers. So what are the main reasons for the early detection of cancers by symptoms? So if you get headache, you will take tablet. Headache means that this is several severe pain. Likewise, with the help of symptoms in the early stages, if you go and consult a oncologist, so with the help of the symptoms we can detect that whether it is, and this is also mostly curable cancer when we detect early detection. The second one in that is, so doctors ultimately write for a histopathological studies. Histology means study of tissues. Study of tissues. Pathology, study of disease, life cycle and agent. So here histopathological studies, histopathological studies, and blood and bone marrow studies for leukemia or bone cancer, and if needed, X-rays or MRI and CT. Here X-rays, so here CT stands for, with the help of this also they can study the cancer. CT means computerized tomography. So with the help of, nowadays when anyone person is suffering from COVID, they are saying the HRCT. So above the chest they are taking the X-ray, CT scan, that is computerized tomography. MRI, magnetic resonance and imaging. So this is highly technological and highly advanced. So with the help of this also, that is radiation, we can also find out the cancers. And apart from this molecular technology, that is genes of suspects by molecular biology also identified. And the next one is biopsy, taking part of body for pathological studies. This is one more technique for identifying the cancers. And also cancer specific antigens through antibody, also we can find the cancers. So by using all these methods, we can find out how the cancers can be identified. So here early detection by the symptoms, which is scalable, and in the case of histopathological studies, that is the tissue and their causative agent, and in the case of blood cancer or bone cancer, so we can use the blood or bone marrow intake for finding out the bone cancers, and X-ray, MRI and CT scan for the respective radiation therapy, where we can find out how the X-rays can be, and also the molecular technology, that is genes of the suspect person by molecular biology also can be identified, and the biopsy, that is taking part of the body for pathological studies also can be useful, and also the finding out the cancer specific specific antigens and antibodies. So these are how we can identify the possibilities of cancers. Treatments of cancers. So what is the treatment or prophylaxis for cancer? What are the treatments for cancer or prophylaxis for the cancer? So the treatment for the cancers are generally surgery. So removal of specific part by surgery is one of the important steps if that part is not required by the body or it is damaging well. So the next one is radiotherapy. By using physical agents of light at different amplitudes or low intensity, certain cancers are curable. So this is the next one. The next one is chemotherapy. Chemotherapy is one more step where chemical components like barium, beryllium, radium at different concentrations which can cure cancers. So this is one more therapy. And nowadays one more thing is called immunotherapy. In this immunotherapy, by using alpha interferons, increase the immunity of persons by suppressing tumor inducing genes or viral oncogenes. Means here in this particular case, surgery is one of the method. The next is the radiotherapy, that is using the different intensities of light and destroying the tumor causing cells or tumor cells are to be disintegrated or died. And chemotherapy by using the different chemical substances where you can cure certain type of cancers by exposing the neoplastic cells to the cell death, or immunotherapy by using the alpha interferons increase the immunity of the person by suppressing the tumor inducing genes or viral or co genes. So these are the 4 methods where this is also very important. 3 mark question or 2 mark question, sometimes 1 mark question, and need point of view also very important question from this possibility is there. Tomorrow we will start with the drug abuse and we will see the next part of the topic.